So what are these bracelets? Wait, you mentioned those bracelets. I've always laughed at them. Like, come on, what the hell is a bracelet going to do for you? Or it's like silicone or it's rubber and there's a stone on it.
Right.
Seriously?
Yeah, it's like acupressure, right? So it's the same
Mm.
exact point we use, unless people are pretty clear of where it needs to be positioned. Catch 22 if it's going to work or not for you. But you can massage it into that point. And it's like, I tell people, if you don't want to, use a pencil, like an eraser of a pencil on it, because that gives a little bit more pressure. But it is an accurate point and it works significantly well for nausea.
I think what's important to know there, which is something that she had taught me, is that if it's not in the exact right spot, you don't get the benefit. So most people are going to walk into the pharmacy, grab the bracelet and try to like follow the instructions. And it's like down, you can't see my arm, but it's like, halfway down their arm. And it's like, well, that's not where that goes. It's not doing you
That's
any
what I'd be
good if
doing.
it's not, yeah.
I do teach a lot of my patients, like, you can do this at home, but let me show you how you can feel it by guiding you right now. So you know where that bone sits, where those tendons sit, and where that little empty space is, because it works so well.
So the Western side, of course, again, we have medications, and they have sort of like how Kaylee has different places where she can target acupuncture. We have nausea medications that can target different receptors and different places in your body to do the same kind of idea. But then we also have things like ginger. Ginger, I would say, is kind of in the middle. Like, that's a traditional use of ginger, but it's still a widely accepted Western use as well. Like, I used to work with an oncologist who would actually prescribe like the 500 milligram ginger capsules for some of his patients who were kind of refractory to a lot of the other oral medicines, like the prescription medicines that he was using. So he would add the ginger like on top of it for those patients. So that's something that's, again, kind of a little bit of crossover where you get a little both.
I'll ask one last specific, sorry, like overall pain. A common one from an aromatase inhibitor can be bone pain. And I'm not exactly sure where they can experience it, but also if some women, unfortunately, who are metastatic may have pain because it's now in their bones. So what would be some different ways of treating that with the different theories? Same thing with acupuncture?
Yeah, I guess the thing with this is when you need to make sure that you're with a provider that is very aware of looking at imaging, looking at contraindications in that aspect, because with acupuncture, you can't needle or use electric stimulation directly on where you have bone metastasis, because when you increase blood flow to those areas, you can encourage growth.